The music is still going, it sounds like. Maybe we can hit pause on that. Okay, so Ohio is ranked 31st overall when it comes to these four categories: economic well-being, education, health, and family and community. As you can see, education is actually where we're best off, but we'll talk a little bit about the details. Um, one thing I want to just last thing I wanted to say about it is, as you know, anybody who's done work in data knows that it's quite tricky to get all this to match, all these data's points to match in terms of all the different states, and therefore it's pretty interesting what they're able to do. But what we should be using it is to, again, to have some context to compare our current situation with. So in terms of economic well-being, we're 35th in child in poverty and 34th in children with unemployed parents. Again, quite concerning. 13% of Ohio's children are living in poverty, according to in 2023. In 2024, the number is a little bit higher. And this all gets weighed in. In fact, of the 16 indicators, and not all of which we're going to talk about today, of the 16 indicators, only four of them has Ohio improved on, right? Uh, I think it was seven that we've gotten worse. So in the next slide, we'll talk about education. I think one thing that kind of emerges when we look at this data, when you delve into it, is we're actually pretty good relative to the rest of the country in education, which shows like the how the investment that we've put into education in the recent years has been important, and how we should continue to do that kind of work. And eighth grade reading and eighth grade math and fourth grade reading are some of our best areas. However, I do note that that still means that 68% of fourth graders scored below proficient in reading, and 68% of eighth graders scored below proficient in math. So it's not, it's good, but it definitely could be much better. Next slide. Health, there's some concern here as well. Quite a significant number of child and teen deaths. One of the highest obesity rates in the country. In the next slide. And then in terms of teen births and children in poverty, living in poverty areas, also quite concerning, as you can see. Um, I am just going to leave it at that. I invite you all to take a look it up, the Kids Count 2025 Kids Count. We have a new data book that just came out last week. Oh, you can't see it. And I recommend that everybody looks it up. There's a lot of interesting data there, but also please do reach out to us if you want to learn more about this data. If you want a booklet, we could share it with you. And I think there's a lot we can take away from this in all our work. So now I'm going to pass it to Jim Spurlino, CEO of Spurlino Materials. And yeah, thank you all for those 5 minutes.
Thanks, Guillermo. Good afternoon, everyone. I am Jim Spurlino. I'm the CEO of Spurlino Materials. We're a construction materials company based here in Ohio. And while I spent my career building businesses and talking about things like concrete and aggregate, I've also spent more than 20 years involved in supporting and advocating for early childhood investments. It started when my interest was piqued by, frankly, the return on investment of such programs. And then as I learned more about them, the rigorous research that supports their outcomes. I've been involved in home visitation programs just as long, including the board of Hippie USA and Cincinnati's own Every Child Succeeds. Lately, this has led to my work as a board member of the Prenatal to Three Policy Impact Center, which promotes effective state policy, as well as co-founder and chair of Ohio Kids First, a 501c4 dedicated to promoting effective legislators and policy here in Ohio, affecting our families and our children. The benefits of home visitation programs are well researched, and they have evidence demonstrating that investing in these programs yields strong and positive results for children's family and our nation at large. These programs strengthen the economy by fostering families' economic independence and promoting school readiness and academic achievement. Children growing up in impoverished households are more likely to experience increased residential mobility, attend less well funded schools, have an unemployed parent, and live in neighborhoods with fewer resources. These experiences can have a lasting effect, making it difficult for these children to escape from poverty once they reach adulthood. Increasing families' capacity to achieve financial stability can help disrupt this cycle of intergenerational poverty. When parents take advantage of the resources available through voluntary home visitation, entire communities and our state can benefit. Okay, let's get on to the people who know a lot more about this than me and to speak about the specifics. I'd like to introduce Allison Payten, Bureau Chief of the Maternal and Early Childhood Services and Supports within the Ohio Department of Children and Youth. Allison?
Thank you so much for that introduction, Jim, and appreciate the opportunity to spend the next few minutes with you all talking about the Ohio Department of Children and Youth's system of supports through Help Me Grow. If we could move to the next slide, please. So, Help Me Grow is a program that really understands that a child's early experiences influence their brain development and create the foundation for success. Help Me Grow promotes positive outcomes for pregnant individuals, supports child development, and helps to empower families. Help Me Grow offers developmental screenings, community resources, newborn home visiting, ongoing home visiting, and early intervention services to support healthy births and give all children the best possible start in life. With central intake and referral, a single point of entry makes every door the right door to services for families with young children. Help Me Grow Central Intake and Referral, or CIR for short, is a statewide system that reaches out to families, referral sources, and providers to increase quality referrals and connect families to the services and supports that they need to thrive. Central Intake and Referral is provided by Bright Beginnings and its statewide regional partners who develop and maintain relationships with providers, potential referral sources, and other community stakeholders so that together we can support families prenatally through 5 years of life. On this slide, you'll see a visual representation of our Central Intake and Referral model. On the left, there are examples of referral sources. Families and other referral sources across the state are able to contact a statewide phone number, fax number, use a web referral form, or an email address to access services. They can also choose to call the local number to get connected to a specific region. Regardless of how a family enters the program, they will get connected to the options that best meet their needs and that are available in their local communities. This includes early intervention services, home visiting and/or other home-based programs such as Early Head Start and Healthy Start, developmental screenings, and other community supports such as 211, WIC, Pathways Community Hub, and much more. We'll move into home visiting and talk about the home visiting program and the services that it provides as well. Home visiting, as many of you all likely know, is an evidence-based or promising practice service that provides expectant parents and caregivers of eligible children with supports to raise their children who are physically, socially, to allow them to be physically, socially, and emotionally healthy and ready to learn. Any pregnant individual or family with a child under the age of 3 can be referred for home visiting services. This includes new parents, foster families, and kinship caregivers. Some programs have income requirements and others do not. Central Intake can let families know what services are available in their community and can connect them to the services that best meet their needs. On this slide, we'll talk a little bit about some of our models that we implement throughout the state. So the Ohio Department of Children and Youth supports 4 current evidence-based home visiting models of ongoing home visiting throughout the entire state. Each model has different criteria for enrollment, staff requirements, and length of time that they can serve families. The one that you'll hear a little bit more about today is Family Connects Ohio. Family Connects Ohio is a universal evidence-based home visiting model, which provides a nurse home visit to all families, regardless of income or background. Families can then be referred to Healthy Families America and parents as teachers if they are eligible and interested in ongoing home visiting services. Next, we have Nurse Family Partnership, which is a community home health program that provides a personal nurse to pregnant individuals throughout pregnancy until their child reaches the age of 2. We also have Healthy Families America, which provides support to expecting parents to help them prepare for the birth of their child and to support these new parents and caregivers with ongoing education and information to ensure healthy early development. The home visiting provider may serve the family prenatally until their child is up to the age of 5. Lastly, we have Parents as Teachers, which provides support to pregnant individuals and families with young children and can serve the child until they reach the age of 5, which sometimes varies by provider. The family is assigned a parent educator who specializes in child development and shares fun activities, conducts screenings, assists families with goal planning, and connects the family to community resources and events. This next slide talks about enrollment eligibility. So you'll see on this graphic here that Nurse Family Partnership sites can serve pregnant individuals during a subsequent pregnancy up to the time of their delivery and if they meet income requirements. Some sites may require a high-risk medical condition, a specific race, and/or a limited number of subsequent pregnancies. There's also Healthy Families America. It has a target enrollment prenatally up to 3 months of age. HFA accepts alternate enrollments for children 3 months through 2 years as capacity allows. And some Healthy Families Ohio sites provide the model's child welfare protocol. This allows central intake to enroll children up to age 2, referred by children's services agencies regardless of their caregiver's income. And we also have Parents as Teachers. These Parents as Teacher sites can accept referrals for families with children under 3 years and who are also low income. I left Family Connects off that slide intentionally just because I know that we'd be delving into that topic a little bit more in the later slides to come. So home visitors, what do? Home visitors actually do quite a bit. They provide support for healthy pregnancy. They conduct health, developmental, environmental, and relationship screenings. They help to deliver education and information about early childhood growth and development, along with positive parenting practices. They facilitate enjoyable parent-child interactions. They help the family to set goals to promote self-sufficiency that is a parent-driven and family-oriented process, and they acknowledge and celebrate child and family successes. Home visitors also collaborate with other social service providers who work with the family, such as early intervention service coordinators or jobs and family services caseworkers. They connect families to community resources and assist with transition planning for the children and family to the appropriate settings, such as preschool or childcare. There are many positive outcomes from home visiting for participating families, including improved maternal and child health, better school readiness, greater economic self-sufficiency, reduced juvenile delinquency, family violence and crime rates, increased connections and referrals to other social service programs. The U.S. Department of Health and Human Service has a website that has many studies that support these outcomes, and I'll be happy to drop the link to that website in the chat at the end of this presentation for those that may be interested in more information. The one-to-one support of a home visitor offers families with a trusted resource for information that will help their child and their family to thrive. As many may be aware on this phone call, the infant mortality rate for Black and African American babies in Ohio is more than double that for our white babies in the state. Home visiting can address many of the issues that contribute to the disparity in outcomes that we see, from making sure that pregnant individuals are connected to prenatal care to ensuring families have resources to help them prepare for a new baby. Even after the baby is born, home visitors can help with common parenting challenges, such as feeding issues, safety at home, safe sleep, which can help to prevent infant deaths. The information that parents receive from their home visitors is reliable and evidence-based. From managing children's challenging behaviors to understanding their child's development, home visiting offers evidence-based tools and strategies to help families develop positive relationships to reduce the likelihood of abuse and neglect. A trusting relationship with a home visitor allows parents to get answers to their parenting questions and helps them to navigate challenges in a healthy way. Many low-income families who are living in difficult circumstances like homelessness, extreme poverty, incarceration, and addiction. Home visiting can also assist with those challenges as well. Home visiting helps by connecting these families to reliable information along with resources in their local communities. And this slide just shows a few of the quotes that we receive from families about home visiting. Because we know that families receive support, encouragement, and reliable information from their home visitors, the quotes on this slide show just how important that home visiting relationship is for families. One family stated, "These years are so intimidating, exhausting. It's nice to have someone to talk to you and say, 'You're not the only one.' It's a very real relationship." Another family stated, "I had no help on my own, so it has been so helpful to have a home visitor teaching me what to look for." While another family added, "You don't get a lot of time in your doctor's office. You think you will, but you don't. So it's nice to have someone to bounce ideas off of." And finally, one family said of their experience, It's an incredible service to help prenatally and after. My home visitor was a guru during pregnancy and turned into a therapist and everything in between. They're there to talk to. They help beyond just the kid in the program." And so, with that, we want to share that there are multiple ways to get connected and to make a referral to Help Me Grow, including visiting the helpmegrow.org website to access a secure online referral form. You can also call our toll-free number, which is shared on the screen, or email the referral to the email address that's listed on this slide as well. If fax is a better option, you can also fax a completed referral form to the number on the screen above. And I think that concludes our portion of our Help Me Grow overview. And with that, I'll pass it over to Kimberly Friedman, Chief Program Officer with Family Connects International. Thank you.
Thanks, Allison. Next slide, please. So I'm Kimberly Friedman. I'm the Chief Program Officer with Family Connects International, and I appreciate the opportunity to share a little bit about Family Connects Ohio. Next slide, please. So this model has been rigorously researched, and it is very different from many of the other supports and services out there because it is for all families. We recognize that every family has needs after welcoming a newborn baby into their home, but those needs may be different for each family, and there are many supports and services that may be out there for families, but they can be very hard to navigate. So with Family Connects, every family within a community that is welcoming a newborn into their home is offered a visit from a registered nurse to help not only assess the health of the newborn and the postpartum parent, and to provide health information and help with the family identify where there may be needs for connection to resources within the community. And then once a warm handoff is made to those services, the Family Connects program follows up with the family to make sure that they were successfully connected. And through that data and through qualitative data as well, from hearing from families directly, at a population level, this program can help communities identify where there may be needs that families have that aren't being met and where there may be gaps, so that advocacy can then happen to help fill those gaps and make sure that families within the community are getting what they need. Next slide, please. We know that those first weeks after birth are a critical time, both for people who've given birth and also for newborns. Over 52% of pregnancy-related maternal deaths occur within 42 days of birth. And many of those deaths, over 80% of pregnancy-related deaths, have been determined by the CDC to be preventable. Furthermore, from our own rigorous research, we know that almost every single family, 94% of the families in our research trials with a newborn had at least one need for either information from the nurse or connection to a resource in their community. And that serve and return interaction between parents and their newborns, that's so important for building strong brains is happening right at that newborn time. And when there is undiagnosed and untreated maternal depression, that can have a long-term impact on a child's development. Next slide, please. So the Family Connects program was born in Durham, North Carolina. It was developed in the early 2000s between the Durham County, Duke University, and a local community-based organization. And it was really based on hearing from families and what families wanted and needed in that time after birth. But the model was tested twice through 2 randomized controlled trials, the same kind of rigorous testing that happens before a medical device or a new medication is released to the public. And after it was proved to not only have really good outcomes, but to also be an effective investment, the program began spreading across the country, and Family Connects International became its own nonprofit in 2022. And we're really dedicated to working with communities and states across the country to help them bring this program in. And we began working with the state of Ohio in 2024, and the first Family Connects program launched in Ohio in 2025. Next slide, please. So this program is really about building a system that supports families at the local level. It's universal, it's offered to everyone, and that means there's no stigma associated with accepting help. It's not for any particular demographic, it's for everybody. And it's really about responding to the needs of families through a very brief assessment, intervention, education, and support and connection to those long-term programs that Allison shared about with you, if those meet a family's needs, preferences, and priorities. Next slide, please. Our Family Connects nurses use a tool that really helps, as you can see here, across the top places where families typically need support to provide a safe, strong home for children and families. And that covers healthcare, making sure that the home is safe and that families have what they need, that parents are doing well, that there are plans for childcare if that's needed, and that families understand how to support and manage infant crying. Next slide, please. So the nurse home visit entails not only assessing the health of the newborn, weighing and measuring the baby, checking with a head-to-toe assessment, but also assessing the health of the mother, checking blood pressure, head-to-toe scan to check in on the health and well-being as they're recovering from giving birth, supportive guidance around what's normal when you're taking care of a newborn and what one might need as far as maternal health goes, answering questions the family may have, and making connections as the nurse or family identifies needs and aligning those with the family's preferences. Next slide, please. So for a typical family, ideally, they're hearing about the Family Connects program from their medical provider, from their friends. After they've given birth, typically the next day, someone from Family Connects program will meet with them in the hospital to schedule their visit. There are certainly many other ways, as Allison shared with you, through central intake to enroll in the Family Connects program. The nurse visit typically happens at 3 weeks postpartum. It can be in the family's home or virtually if that's the family's preference. And the nurse visit takes about 90 minutes. About 4 weeks after the nurse visit, someone from the Family Connects program will follow up to make sure that the family's been successful in making their connections and to see if any other needs have arisen. And for some families, the nurse will make 1 or 2 follow-ups as well if that is needed after their 3-week visit. Next slide, please. So that rigorous research that we talked about for the Family Connects model, these are just a couple of the positive findings. 50% reduction in infant emergency department visits and hospitalizations in the first year of life, positive parenting behavior, safer home environment, 20% reduction in reported symptoms of postpartum anxiety, and a 44% reduction in child abuse investigations. Additionally, just a couple other things to note, increase in connections to community support, and also increased completion of postpartum visits for the person who's given birth. And we know that according to the March of Dimes, about 40% of women don't complete those postpartum visits, so that's a really important outcome. Also want to share, just related to the emergency department visits, that the program researchers identified $1 for every $1 spent on the program, $3 saved on program costs. Next slide, please. So Family Connects Ohio is now serving families in 11 Ohio counties, and those are listed here on the map. Dark, Erie, Fayette, Greene, Guernsey, Hamilton, Huron, Mahoning, Noble, Shelby, and Trumbull. And ideally, Family Connects can become available to serve even more families in the state. But we are excited to be serving families in these 11 counties. Next slide, please. And Family Connects is serving families all over the country. This is a national movement, really changing the way that families are supported with newborns across the country. So we are currently operating in 20 states. It'll be 21 in September when Family Connects starts serving families in Florida, 55 communities across the country. And since 2017, we've served over 115,000 families and connected families to over 203,000 community services. Next slide. So here's just a couple quotes from Family Connects families. I know you've heard some quotes from families supported through Ohio's full system, so I'll just touch on a couple of these. The first one, I'm a nurse and I didn't realize my headaches were from postpartum preeclampsia. That was diagnosed after the nurse checked me, and we have stories like this pretty continuously of nurses or Family Connects nurses identifying really critical situations and connecting families. And I'll just read one more. The visit was helpful because I was alone with no friends. So in that case, the nurse is providing support for the family. And with that, I am going to pass it over. There's some of our contact information right there to the people who can really speak to the what's happening in Ohio, and that is those who are serving families directly. So I'm going to pass it over to Beth Smith and Joe Williams from Every Child Succeeds in Hamilton County. And thank you so much.
Beth, you're on mute.
Thank you. Okay, starting over. Thank you, Kim. So we are here to share about Every Child Succeeds and Family Connects Ohio here in Cincinnati. So ECS has been in business about 25 years, and they provide evidence-based model home visiting. And so that strives to strengthen family well-being, promote optimal development, as well as foster stimulating, nurturing home environments. It's provided our organization with a unique perspective of our community and what parents of young children need to thrive. So our Family Connects team is passionate about community and supporting parents and babies to be the healthiest possible. We know that healthy parents can build healthy communities. So after most of my career being spent in inpatient, perinatal, and neonatal nursing, the last 5 years have been with ECS as a nurse home visitor. And when the opportunity arose to begin Family Connects, the first in this region, I was honored to be selected as nursing supervisor. Next slide. Okay, so our FCO team consists of a nurse supervisor and 4 full-time registered nurses. We have built a diverse team of nurses that represent the population that we serve, including a bilingual nurse to serve our Spanish-speaking families. Each nurse can see an average of 8 families per week, and those visits averaging 1.5 to 2 hours in length. These visits are tailored to the family's needs while adhering to the Family Connect's fidelity model. Maternal and infant health assessments are completed, screenings for family safety, postpartum mental health disorders, and safe sleep are performed. Families are then connected with a variety of resources that support their individual needs. That may include further medical care, support for food insecurity, connection to benefits, or support for a healthier home. Next slide. Okay, so since beginning visits, we've encountered quite a few clinically significant situations in which our nurses were able to provide critical support. So I'm going to share a couple of those with you. On a recent visit, a nurse weighed a baby and calculated a 12% weight loss from birth. And if we're looking at a 2-week-old baby, that's very concerning. So we expect all babies to be back to the birth weight by 2 weeks, no matter their feeding route. And so she completed a really thorough assessment on this baby and supported the mother with breastfeeding difficulties that she had reported. She was able to watch a successful feed, approximate the volume of milk transfer, as well as connect the pediatrician and the family to arrange a really close follow-up. With this client being Spanish-speaking, having a bilingual nurse to assist in navigating a complex health system and communicating the urgency of the appointment, this family was able to get medical support before the infant had ongoing complications from dehydration and lack of caloric intake. Having a nurse come into a family's home, build trust, and provide evidence-based education can support the change outcomes for postpartum families. And the second one was actually a visit that I completed, and it was a mom who's having a postpartum complication that she hadn't really identified. Her baby was about 23 days of life. She was adjusting well to having another baby at home. It was this family's 3rd child, and they were really familiar with the chaos and sleep deprivation that kind of goes with those first few weeks. She was really eager to have a nurse come out and assess the baby, just being a late-term preemie. She didn't need a NICU stay or anything significant, but mom just felt a little bit better having another nurse out to see them. Baby had gone to weight checks and everything was good. So everything kind of checked out really well until we got to the mother's assessment. And at that point, just going through questions, starting things, realized that with her assessment, that her blood pressure was elevated. It was 184/98. Rechecked it again in 15 minutes, and it was consistent with the first reading at 190/96. So I had suspicions about postpartum preeclampsia and began investigating the client's condition. She did report she had some spots in her vision, and for a few days had an on and off again headache, and reports it sometimes was the worst headache of her life, and it didn't get better with Tylenol or drinking or rest. She said she thought she was just lack of sleep and just the chaos of having multiple children and not hydrating well that was making her feel really bad. So we talked to the family about my concerns and reviewed kind of the post-birth danger signs handout we use with all parents and kind of referenced the education around those potential complications. The client reported that she scheduled for her postpartum visit for another 3 weeks. And so I encouraged her to call, inform her OB staff of the symptoms and concerns, and that her blood pressure is fairly elevated. So when she did that kind of on the spot together, her OB staff instructed her to go directly to labor and delivery for a postpartum preeclampsia workup. When I called back in a week to follow up, the client shared that she had spent 4 days inpatient for monitoring, labs, and medication management for her preeclampsia. She expressed gratitude for the detection and support to get the care she needed so quickly. So many times, birthing people put the needs of their babies before themselves, and Family Connects is a way to support the dyad to both be a prioritized focus. And the last one we'll share is about a different nurse on our team who made a huge impact on the health and well-being of our family. When the referral was received, the baby was a few weeks over our typical kind of time frame. The mom communicated that she just would feel more comfortable someone coming out and assessing the baby. The nurse communicated with the family, planned the visit with the mother, the father, and the infant present. During the pre-visit phone call, the family declined any major concerns. So the nurse, as always, kind of got some education together to kind of cover things that she thought the family could need, even though they didn't say they had any specific concerns. So stuff about development, family dynamics, intake, preparing to go back to work. She reported the visit began like all others with introductions and small talk about pregnancy, health history, and transitioning to having an infant. Here's where she was able to provide the most support. All clients were screened for postpartum depression and mood disorders. This parent scored high on the screener and then began sharing about her experiences. She disclosed that she wasn't sleeping, felt like something bad was going to happen all the time, had issues with other relationships, and was not taking care of her basic needs, and found little interest or joy. She also shared that she had talked about these feelings during her postpartum health checkup, was told it was sometimes normal to feel a little off with the baby blues. So the nurse provided valuable time for the family to share these struggles and build trust, providing this care in their home, to be able to support a family in their own environment where they feel like they are the experts and in control can make a huge difference in their ability to feel trust and be vulnerable. She was open to talking to a professional about how she was feeling, and the nurse was able to connect her with counseling that her insurance would cover. 2 weeks later, when the nurse called back to follow up, the client reported that she had seen the therapist and could now see some hope. Without this intervention from a Family Connects nurse, postpartum depression and anxiety could have continued and had a lasting impact on this family. And so with me here is Jo Williams, who has a really unique perspective, because not only is she a Family Connects home visitor, she was actually an ECS family graduate, and she's a little bit about her experience.
In 2019, I self-enrolled in ECS home visiting. My home visitor provided me with all types of supports. Those included mental health services. She screened me for postpartum depression, connected me with local lactation services, and even connected me to a parent cafe that put me in communication with parents in my area. She tracked my child's ages and stages, made sure that I was aware about possible changes with myself, what to expect with my baby, and just really keyed me into a lot of resources in my community. Like I said, I enrolled in 2019, so COVID hit, and she just really made sure that I was aware of all of the support groups and resources that helped with financing and even parenting just while the world was locked down. For me, it was extremely helpful because I didn't have a lot of people that made up my support team. And she was just very eager to present knowledge to me that helped us both learn and grow. So I am now, thanks to her support, a registered nurse home visitor with Family Connects Ohio. And while I don't see my clients for 3 years, I do make a quick but very meaningful connection and impact with them. I'm also assessing these families for birth people for postpartum depression, intimate partner violence. I'm answering questions. I'm teaching them, providing them with resources and education on how to procure resources for and in the future. And it's just a very unique experience because I've been on the other side, just having an extremely knowledgeable and helpful home visitor. It's allowed me to take some of what I've received and pour it back into the families in the community that I serve. Thank you, guys.
Thank you.
Okay, thank you, Guillermo, Jim, Allison, Kimberly, Beth, and Joe for a great presentation and great information about the importance of this program to the families and to the mothers and the newborns here in the state of Ohio. I also want to thank Cynthia Reese with Ready Nation Ohio for helping us to pull together this meeting and to pull together the panel that you have just heard from. At this point, we will now open the meeting up for any questions from those in attendance. And we can take the slide deck down for the questions. Are there any questions?
I'm Krista Cano with Gongwar. Can someone talk about what is happening in the budget as far as Family Connects and what the impact will be? Thank you.
Sure. I'm happy to speak to that. And I put that in the chat, and thank you for asking that. So Family Connects is funded through Help Me Grow. And so as it stands now, I believe the Help Me Grow line in the budget coming through both the House and the Senate is cut in year 1 by approximately 3 million and then flat funded in year 2. And so for Family Connects International, what we're seeking is to have the funding restored so that it lines up with what was in Governor DeWine's executive budget. So the Help Me Grow line in the Ohio Department of Children and Youth Agency budget was funded at 63 million for year one of the new forthcoming biennium, and then a $22 million increase in year two. And I believe much of that increase was intended to grow Family Connects to the rest of the state. That will not be possible, I believe, with the budget as it currently stands. And I'm not sure what the impact of the cut in year one would be, but certainly Family Connects would not be able to grow to other Ohio families.
Thank you, Kimberly. Are there any other questions from the audience? If you have a question, just go ahead and unmute your mic and ask the question.
John, I'd like to follow up on that, even though I'm from Ohio and on the panel, but um, I'm kind of curious, Kimberly, if you have a view of how Ohio compares with other states in the country in its coverage of these at-risk families, with particularly these kind of services that you're talking about that are so critical in those early years of childhood. And even if part two is, if you can give us a sense of what $3 million might mean in terms of service to number of families. Is that about 1,000 families, and is 20 million about 6 or 7,000 families? Just to kind of give us a scope of what these cuts from the governor's budget might really look like in terms of family service. Thanks.
I mean, certainly $3 million can mean many families not being able to access many services, because as we heard from Allison, these services all work together, right, to support families. And so families may lose access to lots of different supports that way. I think the governor has certainly done a wonderful job of building the investments for the targeted programs that Allison shared, the Healthy Families and Nurse Family Partnership. But the challenge, and parents as teachers, but the challenge is we know that really every family has needs, and also the investments, whether it's through the state or federally, that are being made to build, to make all kinds of supports and services for families, don't matter if families can't find them and access them, or if the right families who are eligible aren't accessing the right services at the right time. And so those investments in services, whether it's through the central intake or programs like Family Connects, can really help make sure that all of the investments that the state is making are used wisely, because families, the right families that fit the services, can find them and use them at the right time. I hope that was helpful.
Thank you, Jim, for the question, and thank you, Kimberly, for responding. We have about 10 minutes. Any additional questions? Again, if you have a question, just unmute your mic and ask the question.
John, can I make one quick comment?
Absolutely, go right ahead.
I really love the kids count data. That work has been going on for years and years. It really is nice to see how it boils down how we're doing. And I think Guillermo did a great job of pointing out, we're state of Ohio lacks some progress and is doing okay, but it also points out even when we're fourth or seventh in the nation, we're still, leaving a lot of kids behind. And so let's not be too proud of being fourth or seventh amongst lousy work being done overall. That's number one. Thank you, Brianna, for putting in the chat box the link to that kids count data. The other thing, so I would suggest everybody should look there. And the other thing I would suggest is to go to that prenatal to 3 policy impact center, and look at the data there, because they publish state reports for every state in the nation about how every state does with effective policies and effective strategies for families with young children. And if we as a state, if we as Ohio care about how we treat our friends and our families and our neighbors, let's look at how we're doing relative to other states. Let's compare ourselves and say, are we really doing as well as we should be doing? And I think those are important resources for everybody to take a look at: the kids count data, the prenatal 3 policy impact data. And while I love sports and I would love to pay lower taxes, I think we need to take care of our own, and we need to see what other states are doing to see if we're really doing as good a job as we can, or should we be redoubling our efforts. So thank you.
Yeah, thanks, Jim. I'll just add that we are working with a number of states who have ranked really high in that prenatal to 3 policy impact center, where Family Connects is being rolled out statewide, along with lots of other services and support. So that is a great resource to look at.
Then I will ask the question. I'm State Rep Karen Brownlee, and I would love to know, in looking at that data, which states are making progress, which states are hitting better success measures, so that we can be looking at the right states.
I believe Colorado ranked as number 1 for all the different policy levers and strategies that are laid out at the Vanderbilt's Prenatal to 3 Policy Impact Center. And that is a state where Family Connects is working to roll out statewide. They're doing a lot of wonderful things in Colorado. So it would be good to look at all the different, I think they're hitting all of the policy levers and strategies in the state of Colorado.
Can I just add to that real quick? Because that's a great question. And, states are very different. And Colorado's doing a great job. A number of other states are. New Mexico, the state of Washington, some of our eastern border states are doing very well. And it's certainly easy to say those are different populations than maybe Ohio. And that's possibly true, but I think that we need to look at how we're doing compared to other states. And maybe as a state representative or a state senator, just as much we ought to care about how are we doing versus Kentucky and Indiana and Michigan and the states that we compete for economic development on. And just as important is that when we spend all of our hard-earned tax dollars supporting economic development, let's make sure we have a workforce there to support that investment, because those companies will come and build buildings and build factories. But if we don't have a workforce, that investment's going to dry up, but not the tax dollars we've spent already bringing them in. So I think that's a great question. And I'd urge you to look at not just how we do against other states, but look at how we do against, frankly, our neighbors.
Thank you, Jim. Thank you, Kimberly, again. Appreciate that. Any additional questions? We've got about 3 minutes left. Okay.
You're on mute, John.
Thank you very much, Jim. Appreciate that. So this was a great presentation by the panel members, and really appreciate the information that they have shared with us. So thank you, Guillermo, Jim, Allison, Kimberly, Beth, and Joe. I also again want to thank Cynthia Reese with Ready Nation Ohio for her efforts in pulling this all together for you this afternoon. If you want to take a second look at this meeting or the slide deck, we will upload both later on this week to the Ohio Legislative Children's Caucus website. Or you can also just give us an email, send us an email, and we can email it to you. The next meeting of the Children's Caucus will be in the fall after the General Assembly returns from their summer break. So I wish you all a great summer. Please keep an eye out for the next invitation. Thank you all again for attending the meeting today and have a great rest of your day.
Bye, everyone.